you're like most people, you've probably never heard of amblyopia, and that's a problem. Your child might have amblyopia and you don't even know. Amblyopia is one of the eye conditions that devastates me the most because it affects children and their vision for the rest of their lives, and in most cases is totally preventable. I'm going to talk about some of the fears and questions that people have when it comes to taking their kids to the eye doctor later on in this video. So if you're in that boat, be sure to keep watching. If a child does not have amblyopia, even having an eye exam early on can catch problems before they start. Because a child who needs glasses but doesn't have them may struggle academically, socially, behaviorally, and psychologically. When we're born, we have poor vision. Vision develops over time, but in order for our vision to develop, we need clear visual input. If our vision is significantly limited in one eye or both, the vision will not develop to its full potential in the affected eye. As we grow, our brains decrease in neuroplasticity, meaning that they are less flexible when it comes to development. Childhood is a critical time for brain development, including vision development. So if vision does not develop fully by the age of 7 or so, without prompt and consistent intervention, the vision will never fully develop. Let's say everything about the eyeball itself is perfectly healthy, or that whatever was causing the poor vision in the first place is fixed but at a later age. That will not matter. It is the brain that is the limiting factor here. The brain did not fully develop visual processing, and the older you are when amblyopia is treated, and the more severe it is, the harder it will be to train the brain to process vision and allow someone to see perfectly. If a child is beyond the age of 12 or so, it will be difficult to achieve perfect vision, and perhaps vision may not improve at all. I think comparing it to a more familiar condition makes it easier to understand. So some people who are born deaf and later in life receive a cochlear implant may struggle to speak with accurate pronunciation, rhythm, or intonation. This can occur because of limited exposure to spoken language during critical periods of language development in childhood. Vision development works similarly. You could also compare the inability to obtain clear vision at an older age in someone who has amblyopia despite an otherwise healthy eye to the difficulty people face mastering an accent when learning a new language at an older age. Some, no matter how hard they try, will never reach the full potential that they may have if they had learned the language as a child, because the critical period for language development has passed. For the techies out there, think about a computer from the 80s. You can get the most amazing modern video playing software to try to watch a video in HD, and if you can somehow get it to connect to the old computer, there is no way that screen is showing you an HD image. The computer is the visual processing center of a brain with amblyopia. The software is an eye that has been cured of whatever was causing the amblyopia, but after the critical vision development period. The eye is now perfectly healthy and perfectly clear, but it is the processing that's at fault here. We call these amblyogenic factors, and they could include media opacity, which would be most commonly congenital cataracts, something that's physically blocking the vision, the light from reaching the retina, strabismus, which is an eye turn, or refractive error, which basically means you need glasses or contacts. The severity of amblyopia and vision reduction will vary depending on how long the condition was present and how severe the vision limitation was during that period of critical development. The vision can range from just a slight reduction, maybe like 20/30 or 20/40 on an eye chart, all the way to reduced to counting fingers, where they struggle to read fingers on an examiner's hand from a short distance. But it can be kind of anywhere in between. If you think about it, congenital cataracts, if they were to go untreated, they would cause the greatest reduction in vision because they are totally blocking the vision. But fortunately, these are spotted pretty quickly around the time of birth and removed promptly. The other amblyogenic factors would be strabismus, which is an eye turn, which is generally pretty easy to spot, although sometimes eye turns can be subtle and better spotted by an eye doctor. So early eye exams are important for catching and treating strabismus. The amblyogenic factor that I think is the least obvious to a parent would be refractive error, or the need for glasses or contacts. And that's because some kids, they don't know what vision they're missing. If their vision has been blurry their whole lives, they've never experienced good vision, so they have nothing to compare it to. So they may be dealing with frustrations with seeing, but they don't know that their vision is actually the problem, and they don't always have the communication abilities to be able to explain this complex issue that they're having. So it's very difficult for a parent to tell if a child is having trouble. Sometimes you may notice that they're squinting, or that they get really close to something, or that they're appear to be trying to focus, but it can be hard to tell. This can happen if they have a very high prescription in one direction or the other, whether it's hyperopia, myopia, or astigmatism. And it could also be because there's a very big difference between the prescriptions in one eye compared to the other. And the one that is the higher will tend to have the worst vision. And the higher the prescriptions are in general, that will tend to cause worse vision and more severe amblyopia. To treat amblyopia, first, the underlying cause needs to be addressed. In the case of congenital cataracts, these cataracts will be removed. In the case of strabismus, there are a lot of different treatments out there, and I'll be doing a video later on that, so be sure to stay tuned and subscribe. But usually in strabismus, they don't do a surgical correction of the alignment of the eye until the amblyopia has resolved, because sharp, clear vision also helps the eyes to stay together once the surgery has been done. But typically for that and for refractive error, giving the best possible glasses prescription for full-time wear is the starting point for treating amblyopia. So once the cause of amblyopia or amblyogenic factor has been addressed, the eye itself now has access to greater vision. But it's the brain that we need to exercise in order to train it to catch up to what the eye is capable of seeing so that the vision can be clear. Training the brain requires consistent access to clear vision. So that means full-time wear of whatever vision correction is needed. So any glasses prescribed need to be worn all of the time. In addition to the best visual correction, a patient may be prescribed to do a certain number of things to exercise the brain and focusing primarily on the worst eye, trying to get the eyes to be even. So this can be done with patching therapy. A patch is actually put over the better seeing eye to force the weaker eye to do the work to try to catch up. And I know I'm saying weaker eye, but we really know it's not the eye that's the problem here. It's the brain. It just needs to happen with that pathway between the eye and the brain, and it needs to strengthen. So patching the good eye forces that to happen. If a child is resistant to patching therapy, atropine eye drops can be prescribed, and sometimes this is a few times a week, up to every day. That drop will be put into the better seeing eye as well to make it blurry in order to force the weaker eye to do the work to catch up to the better seeing eye. And during these therapies, doing detailed visual tasks will be recommended in order to exercise the eye to a greater ability. It's not just okay to put on the patch and watch television. You need to be doing something that really engages the visual system, like word puzzles or a regular puzzle. There are a lot of different things that a doctor may recommend. It's important to note that patching therapy isn't done all day, every day. It's usually done from 2 to 6 hours at a time, most days of the week, but these treatments are going to depend on each individual's needs, and it's best to find out from your doctor what exactly is recommended. It's also important not to overpatch, because sometimes you can cause amblyopia in the better seeing eye. Let's say if you were having the child wear the patch all day long, that wouldn't be recommended. Vision therapy may also be prescribed, and this is also helpful to get the eyes to work better together, because once you equalize the vision in each eye, you also need to make sure that they are now working together. Treatment will continue until the vision between the eyes is equalized, or until no improvement is consistently seen. Treatment usually needs to be done before the age of 12. Though recent studies show some improvement in older patients, the level of improvement is limited compared to these younger patients, or improvement may not occur at all. Follow-ups will depend on the age and how treatment is going, but it could range from every few weeks to months and then slow down to yearly as vision improves or reaches a plateau. Even if your child's prescription is not significant enough to cause amblyopia or they don't have another amblyogenic factor, children may still be struggling academically, socially, and psychologically due to difficulty seeing the board or succeeding in sports or navigating the world, and it could all be due to uncorrected vision. Yet they do not know how to communicate that their vision is blurry because they've never known any different. Plus, in general, children are just learning how to communicate and struggle to discuss complex concepts. So taking them to an eye exam to get their vision corrected may help them surpass any of these issues that may have happened by giving them clear vision in the first place and eliminating unnecessary stresses and troubles with self-esteem that can happen because of the difficulty in vision. Let's talk about some of the concerns you may have when it comes to bringing your child to the eye doctor. I'd like to address these and hopefully put you at ease. So you might be thinking, how do they do the vision test if children can't talk? You might be thinking about the test where the doctor asks, which is better, 1 or 2? And ask yourself, my child is too young to speak, so how are they going to choose? Well, did you know there are ways to determine a glasses prescription in individuals who are unable to respond? There are 2 ways we can do this, and often both are used together. One is using an autorefractor, and you have probably done this test yourself. You'll look into an instrument at a target, and it will come in and out of focus. This machine is estimating what your glasses prescription should be. A doctor often uses this as a starting point for a refraction, which is the better 1 or 2 test. They can also use this as a starting point for retinoscopy. Retinoscopy is truly amazing because the doctor will use this instrument to flash a light across the eye. The doctor evaluates the reflection of the light in the eye and will change lenses in front of the eye until the movement of the light appears neutral. The lenses can be in a 4-opter or handheld, something that looks like this, or loose lenses like this. And the lenses in place will reflect the glasses prescription that's needed. No response from the patient is needed, and someone who does this a lot can evaluate an eye in even less than a minute. There are even autorefractors available that are handheld and easy to use on young children, as well as the tabletop kind that you might be more familiar with as an adult. So what about the dilation drops and the discomfort and the crying, possible tantrums, fear of the doctor? Well, as a mother, I completely understand the desire to protect your child from any form of pain, fear, discomfort, or sadness. And as a doctor, I understand that a few moments of ocular irritation and even possible tantrums are worth protecting a child from what could be a lifetime of poor vision. The truth is that dilation drops are needed, especially for children and especially for a first eye examination. Just as children are full of energy, their eye has this immense ability to focus. It's also young and flexible. The action of doing a vision test can cause an undilated eye to focus on objects that are up close, and the vision test needs to evaluate vision at far distance in order to be accurate. You cannot determine an accurate prescription that is needed without temporarily preventing the eye's ability to focus. In fact, often a stronger dilation drop is used on children compared to adults. So don't be surprised if their pupils look big for a day or longer, whereas your dilation may only last a few hours. Something else to keep in mind is that sometimes dilation drops are used in the treatment of amblyopia. So it's better to do it once a year in a doctor's office to prevent the weekly or even daily eye drops at home to treat amblyopia. Also consider a child's possible tantrums or difficulties that may occur when patching the eye or doing vision therapies. Now, if your child does have amblyopia or another condition that requires vision therapies or patching therapies, Please don't let this discourage you. There are certainly ways to get them to comply and to make it fun. I am simply saying that it is better to avoid the need for these treatments if it is possible, especially if all it takes is a simple eye exam. I'm sure there are those out there who are concerned with the expense of an eye examination and glasses or the lack of insurance. And truly one of my greatest frustrations with the healthcare field is the expense, particularly that of glasses. Fortunately, there are many insurance options in the US for children that may be available even if their parents are not covered. These could include Medicaid or CHIP, and there are also school or community-based programs like the Lions Club, Prevent Blindness, and InfantSEE. InfantSEE is of particular note because doctors involved in the program provide free eye exams to infants ages 6 to 12 months. So you can find out if your child has any of those amblyogenic factors we talked about earlier. The link in the description will take you to a website where you can find a participating doctor in your area. Something else to keep in mind here is that if your child needs to be treated for amblyopia, they will almost always need some sort of vision correction, whether glasses or contact lenses. So you will need to find a way to get them glasses eventually. And certain prescriptions are so high that they're hard to adapt to, especially if the child is on the older side being treated for amblyopia. So sometimes they may need to get multiple pairs of glasses over the course of just 1 year to ease into that correct prescription that they need. So that can get expensive. And there will be more appointments needed to treat amblyopia than if there was just one initial appointment in the first place when they were younger. Some parents or caretakers may have a personal fear of doctors, so don't let your own fears get in the way of taking proper care of your children and their vision. You are the only one who can truly advocate for your child. They cannot yet advocate for themselves and they need you. A loss of trust in doctors is a devastating result of a healthcare system gone awry, so talk to your family, friends, coworkers, research online yourself to find someone you may feel the most comfortable with providing care to your child. It's important to note that amblyopia is not always avoidable. So as long as you're doing the best that you can, following up with the doctor and following with a treatment plan, that's really all you can do. Regardless, we must try to prevent amblyopia in the first place or treat amblyopia when present, especially if a child is still in the critical period of vision development. Remember, if you're doubting whether your child is ready for an eye exam, the recommended ages for an eye exam are between the ages of 6 to 12 months, and then again at least once between the ages of 3 to 5, and every 1 to 2 years from then on if everything is normal. There may be more frequent appointments if a diagnosis is found. Doctors are trained to evaluate eyes of all ages, and there are those who specialize in pediatric optometry or ophthalmology. So your child is probably never going to want to go to the doctor, but you know what's best to protect them and give them the highest quality of life long term. And that means making sure they can see to the best of their ability. Don't forget to check out the links below for resources on children's eye examinations and call to make an appointment. Thank you for watching, and I hope to see you next time.